Rethinking what I eat to keep me healthy.
Choose Eat Smart.
Rethinking tobacco prevention.
Fight with fact.
Rethinking drug prevention. Drug drop boxes. Woo!
Rethinking access to mental health care in our community.
Rethinking where we get our foods. School gardens.
Rethinking my choices at school lunch, locally grown, healthy, and delicious.
Rethinking talking to parents about sexual health.
Rethinking getting to school. Walking school bus.
Rethinking getting from point A to point B. Drive your bike.
Hello everyone, and welcome to Rethink Your Life, Your Choice. We bring community leaders, advocates, and residents like you to find solutions to some of the most important prevention and health issues we are facing today. I'm your host, Heidi. Thanks for joining us. We're excited to transform Winnebago County into a community focused on implementing solutions for better health, where our residents live, work, learn, and play. Today our show is focused on mental health, how Rethink is involved in local initiatives, and how other organizations are working on improving services to people. Our first guests are Kristen Biese and Cheryl Laabs, Chair and Co-Chair of the Rethink Healthy Lifestyle Committee. Welcome, and thanks for being here.
Thank you.
Can you tell us, Kristen, a little bit about the Rethink Healthy Lifestyles Committee?
Sure. The Healthy Lifestyles Committee is a broad range of community partners that are all working together to provide increased access to wellness initiatives to Winnebago County residents in all dimensions of wellness, such as mental health, dental health, safer sexual practices, and injury prevention. And for the past couple of years, we've been primarily focusing on mental health care.
Great. And how has the committee been working to address mental health?
Well, a couple of years ago, the Healthy Lifestyles Committee arranged a focus group, which we called the Mental Health Share Shop. And the Mental Health Share Shop brought together community partners, healthcare providers, law enforcement, teachers, and lots of other individuals working with mental health care to talk about what our specific needs were in Winnebago County. And at the first meeting, we chose to work on access barrier issues as well as decreasing the stigma of mental health. And the group has continued to meet. Since then, we have broadened our aspect to a more regional approach and collaborated with the Northeast Wisconsin Regional Mental Health Connection.
Excellent, great. What about some specific examples of initiatives that the group is working to implement?
Sure. And the regional aspect, the Northeast Wisconsin Mental Health Connection, we're part of the No Wrong Door initiative. And No Wrong Door stands for no door is a wrong door to ask for help. With that in mind, there are two phases that are part of that committee. The first phase is providing training to mental health providers and staff regarding customer service, mental health 101, compassion fatigue, and knowledge of our local resources.
Okay.
The second phase, which we're really excited about, is a software program that we'll be piloting soon with some of our local healthcare providers. What it will do is streamline the process for our patients so that they're able to come into a healthcare provider, and if that provider isn't able to help them, providers are able to make direct referrals to other agencies without the patient having to retell their story.
Okay, excellent. So it sounds like we're really working on some systems improvement.
Absolutely, yes,
Great.
Absolutely. Eventually, we hope that all of the providers are linked together with this this software program. It's titled RAIL, the Referral Access Information Link.
Great.
So besides the providers, it would be really great if we could get law enforcement connected and some of the other places where people go to ask for help.
Right, so law enforcement could directly refer somebody on the system?
Correct.
Like on the computer system?
Yes.
Okay,
Yes.
neat. So it
would
sounds
be really
like
neat.
it's just getting started, piloting it, and it has lots of room to expand.
It does.
Okay,
Yes. We're
great.
very excited about that.
Yeah, that is a great service for improving access to mental health services.
Yes. Another thing that we're working on is the United Way 211 poster campaign. We are distributing posters to salons and bars, laundromats, restaurants, ideally places where people have privacy to pull a little tear sheet where they can contact United Way for community resources as well. So we're working on that. And last but not least, we are a part of the Be Well to Excel Connected Community Wellness Screening.
Okay.
So that's being implemented this fall at Oshkosh North and Oshkosh West. Screenings just started and seem to be well received.
Great. Well, thank you for sharing those updates, and it's exciting what Winnebago County and the greater area is working on to improve mental health services.
It is. Thank you.
Cheryl's our public health nurse at Winnebago County Health Department. Can you shed some light on the Be Well to Excel program and why high school students need an emotional wellness screening?
Sure. And first of all, though, I want to thank Kristen for her 3+ years as being the chair for our Healthy Lifestyles and Mental Health Share Shop meetings. You've been an awesome leader, a visionary, and you've been great. Thank you.
We're going to miss you, Kristen.
We are, yes. On that note, why would students benefit from an emotional wellness screening? First and foremost, simply it's a screening tool to help identify youth at risk for mental health concerns. Early identification of potential mental health issues is a key role in a young person's ability to succeed in school, to have relationships with their family and friends, to just have a productive life, a happy life. And so it's so important to find these things out earlier versus later. Detection, early intervention is always a positive thing. Our screening with the Connected Community Wellness Screening helps to identify teens at risk for many things: depression, anxiety, substance abuse, suicide risk, and then some of those other things that are easily looked over, that people don't even realize, the conditions that go undetected. The screening itself is a mental health check-in, which can help ensure mental well-being for our youth.
Okay. Well, thank you for explaining the benefit of having a wellness screening. It sounds like it's an important tool for high school students. Should all students be taking this, participate in the screening?
Short answer, yes.
Okay.
I mean, that would be great if all students participated. However, this is a voluntary screening, and it is a screening that both the parent and the student have to consent to before we can administer the screening.
Okay.
So unfortunately, probably not all students will be screened. But I would like to share with you some local data that really will validate the importance of participating in the wellness screen. We have some local, state, and national data, and we can compare it. The data that we'll be using is called the YRBS, which stands for Youth Risk Behavioral Survey, and it is a national survey, like I said, but I want to share with you local data as well as state and national data. So I know the slides are up, and I brought 4 slides along to reflect what our teens are actually saying in regards to mental health issues in our community. For this first slide, and I just wanted to share too, I am a parent of teens, and I know that high school can be a really stressful time. Homework, peer pressure, exams, extracurricular activities, and it's hard as a parent to know what's normal and what's not in regards to juggling all of these things, and what's truly a concern and what is just normal stress, because our youth are under a lot of stress. This first slide actually it's very alarming, because it shows that in our area, 26.1% of our students in Winnebago County, and again, I should clarify that these YRBS data statistics are from spring of 2014. And with that, it's very current and very relevant data. 1 in 4 students in a classroom of 20, and that's a small classroom, would say that they are persistently, sad or hopeless for daily for 2 or more weeks. So that's 1 in 4. And I think that statistic really stands out.
Yeah.
The next slide is actually a slide that shows the steady increase of that same question. So again, these are students that are saying they've been sad or feeling hopeless daily for 2 or more weeks. And you can see from 2010 to 2014, the graph, it basically a percentage point per year.
Okay.
And that's not the way we want to see that graphic go.
Right.
So that is showing us that we really do need to do the screening in the school.
And so, like you said, these are our high school students at the high schools in Winnebago County.
Correct.
Okay.
And with the YRBS, the data is from freshman through senior year. And again, this is it's all of the high schools put together. So from our 5 local school districts, it would be all of the stats, the aggregate number of kids. And you can see it shows 9th, 10th, 11th, and 12th grade. And then at the Winnebago County as a whole. And then it compares it to the state and national data. And you can see for this one, during the past 12 months, did you ever seriously consider attempting suicide? 18.6%, which is over the state average and the national average.
Wow.
So, slightly over.
Right.
But still concerning,
Absolutely.
And now this last graphic is the most disturbing out of all of them because it does show with the question, during the past 12 months, how many times did you actually attempt suicide?
Okay.
And in Winnebago County, it is 13.9%. The state average is 6%, and the national average is
So
8%.
you're saying that we have 13.9% of high school kids in Winnebago County have actually attempted suicide?
That's what our students are saying.
Okay. 1 minute.
Okay. And in closing, I brought a wellness brochure from the Connected Community. I just want to close with this. For most parents, this wellness screening will reassure you your teen is experiencing typical growing pains. For other parents, the screening can help you pinpoint a problem in its early stages, giving you the ability to secure needed help for your teen and reduce the chance that a more significant problem will develop in the future. That being said, Rethink and the Winnebago County Health Department are excited to support Samaritan Counseling Center in their implementation of the Connected Community Wellness Screen.
Thank you so much for sharing that information. It's really, really important. And thank you, Kristen, thank you, Cheryl, for coming. Right now, we're going to take a closer look at the Community Connected, the Emotional Wellness Screen that's going on right now at Oshkosh West High School.